Good afternoon, Dr. Berger.
Good afternoon, Irina.
So there is a talk that GLP-1 also can be longevity medication. What are your thoughts about that?
So yes, I've been seeing online quite a bit of talk about these sorts of medicines perhaps being geroprotective, in other words, extending life. I think that's likely, and I'll tell you why. So, of course, just to give a little background in these medicines, we're talking about medicines like semaglutide and tirzepatide. Semaglutide being branded as Ozempic for diabetes and Wegovy for weight loss. And in terms of tirzepatide, Mounjaro being branded for diabetes and Zepbound for weight loss. So, of course, they're both FDA approved for that purpose. However, semaglutide has been shown in patients without diabetes if they've already had some sort of cardiovascular event, such as a heart attack or stroke, or if they have peripheral artery disease, to reduce the incidence of a second cardiac event, and also to reduce the risk of death by a cardiovascular cause, or MACE, by 20% in those patients. So in high-risk patients with CVD, it really decreases the risk of something else cardiac happening in those patients. So that's the SELECT trial for semaglutide. And it's now also FDA approved for MASH, so metabolic associated steatohepatitis. So this is inflammation in the liver that's caused by fat deposition in the liver. It can lead to cirrhosis, fibrosis, as well as liver cancer. And so semaglutide now approved for that. It's also been shown in the setting of diabetes to help to improve chronic kidney disease. So a lot of promising things for this medicine. Let's talk about tirzepatide now. So, of course, as I mentioned, already FDA approved for diabetes as Mounjaro and weight loss as Zepbound. Zepbound, so patients without diabetes, but who have obstructive sleep apnea, which is often goes with elevated BMI. So Zepbound now approved for treatment of obstructive sleep apnea, even independent of obesity. And it decreases visceral adiposity, so the fat that could be around the organs, which contributes to things like fatty liver, diabetes by fat deposition in the pancreas, and cardiovascular disease by deposition of fat in and around the heart. And it also decreases liver enzymes, so it decreases inflammation in the liver too. So given all of the promise for these medications, things that we already know they do, that definitely can shorten someone's life. There's also promise for these medications in terms of treating Alzheimer's and certainly in preventing it. And we also know everything that's associated with obesity beyond those things, such as 13 different types of cancers. So whether patients who don't have any of these chronic metabolic problems, don't have obesity, they're generally healthy, should they be taking any of these medicines to prolong their lives and ideally the quality of their lives, that remains to be seen. But we know in patients who have these various issues, they really are excellent treatments. So I'd say they're very promising. And just as an addendum, the other long-term medication for diabetes, metformin, that's been around for decades and we know is quite safe. Still in the midst of enrollment is the TAME trial to look at metformin as a potential longevity medication. So in terms of the GLP-1 and GLP-1 GIP medicines, definitely a lot of promise. This is something we certainly should keep our eye on. But in the meantime, we know for so many metabolic problems and the things that go with them, these medications such as semaglutide and tirzepatide are really excellent treatments. So remember, of course, that everything I talk about on these videos is for educational purposes only. No doctor-patient relationship has been formed. And if you have particular questions or concerns, please don't hesitate to reach out to your medical professionals. If you'd like to learn more about how we can help you with your health and optimize it, we're Northeast Medical Practice in Great Neck, New York, 516-604-3418, online at northeastmedicalpractice.com, through our various social media channels, our YouTube channel, as well as our podcast, LongevityMD, which is on Spotify. But until we see each other next time, be in good health.